Hello, my name is Lisa Hill. In this presentation, I will propose an evidence-based care plan to improve the safety and outcomes of the patient in the VILA health scenario. Caitlin, a 2-year-old toddler, presents with pneumonia for the second time in the last 6 months. Caitlin is being cared for by Dr. Copeland and nurse Virginia Anderson. After a thorough physical examination, a careful review of Caitlin's medical records, and collaboration with her nurse, Virginia, Dr. Copeland has diagnosed Caitlin with cystic fibrosis. Cystic fibrosis is a chronic progressive disease that affects the lungs, pancreas, and other body organs. It causes a buildup of mucus in body organs. It leads to repeated infections and poor nutrition. It is an incurable genetic disease. Patients with cystic fibrosis are at risk for impaired gas exchange and nutrition less than body requirements. They are also at risk for distal intestinal obstruction syndrome. Caring for a patient with cystic fibrosis will require extensive education and can be overwhelming. Cystic Fibrosis Foundation, no date. Aside from this being a new diagnosis of a chronic and eventually fatal disease, providing care for Caitlin will be especially challenging for the following reasons. Caitlin lives in a remote area in a part of the country with limited healthcare access. Also, the area is known for harsh winter weather, making driving hazardous. Her parents are separated and both work long hours. There are financial concerns related to a now resolved period of unemployment by Caitlin's father. There is a lack of psychosocial support due to living in a remote location. Caitlin's care team consists of Dr. Copeland, a pediatric nurse, a respiratory therapist, 2 social workers, and Caitlin's local pediatrician. Caitlin's care team must collaborate remotely to develop a plan of care that will address these concerns as well as the concerns inherent to the diagnosis of cystic fibrosis. The care team must collaborate to answer the PICO question: how to provide timely evidence-based holistic care to a newly diagnosed toddler living in a remote location. The Johns Hopkins Nursing Evidence-Based Practice Model was used to develop Caitlin's plan of care. This is a 3-step model consisting of a practice question, evidence, and translation. The first stage in this model is the practice question, in which the team is formed. Responsibilities are assigned and the evidence-based question is developed. In the second stage, the evidence phase, the question is researched, the veracity of the evidence is determined, the evidence is summarized, and evidence-based recommendations are made. The third phase is the translation phase, in which appropriate use of the evidence is determined. A plan is created and implemented based on the evidence. Outcomes are evaluated, stakeholders are presented with results, which are distributed, and planning continues. Veterans Administration 2015. Using an evidence-based practice model ensures that the most recent research results and appropriate best practices are used to develop a plan of care. When patient care is evidence-based, patient outcomes are improved. The practice model was used to help the team develop the PICO question, research the question, and apply evidence-based interventions. The following care plan has been proposed as follows. Problem 1. The patient lives in a remote area in a part of the country with limited healthcare access. The area is known for harsh winter weather, making driving hazardous. The team will collaborate via digital technologies to plan the care of Caitlin. Digital technology such as telehealth bridges the gap between patient and provider by making healthcare more accessible. American Hospital Association, 2019. Education on the disease and disease management will be provided through telehealth technology. Assessment will be provided by telehealth. Home health personnel will assist with education and assessment when required. Home health personnel will obtain ordered labs, and results will be reported to the appropriate healthcare clinicians. Problem 2. Caitlin's parents are separated and work long hours. Through thorough disease management, education will be provided to both parents remotely using digital technology. Caitlin's parents will be referred to local hospice or respite care to provide short-term relief for the primary caregiver. Problem 3. Financial concerns due to the prior unemployment status of Caitlin's father. Caitlin's family will be referred to local community resources that can provide financial assistance. The patient's insurance company will be contacted to determine if case management is offered and to help the family understand their insurance coverage and their financial responsibility. Problem 4. Lack of psychosocial support group due to location. Caitlin will be referred to local home health for case management that can assist in connecting the family to local support groups. The hospital social worker will assist the family with an internet search to help the family to find online support groups. According to Kirk and Milnes 2016, online support groups promote self-management of cystic fibrosis and provide the family and patient with the opportunity to exchange information and experiences. Outcomes will be evaluated by comparing the patient's goals to the actual results. We will know that the patient outcomes are positive when the patient is stable and has fewer respiratory infections, hospitalizations, and fewer ER visits. It can be determined that the outcomes are positive when the family is aware of the financial, psychosocial, and community resources that are available to them. In the planning of Caitlin's care, it would have been helpful to know if other caregivers would be involved in her care in the absence of her parents. Additional caregivers will require education on how to provide safe, effective care. Patients living in remote areas experience health care disparities due to inadequate access to health care. The use of digital technology such as telehealth helps to bridge the gap between people living in remote areas and healthcare access. The American Hospital Association 2019 highlights the benefits to the patient as well as the healthcare provider. Currently, over 75% of hospitals in the U.S. use some form of telehealth. The use of digital technology increases the value of healthcare and makes it more affordable. It reduces drive time for the remotely located patient. It also reduces unnecessary trips to the ER. It reduces provider burnout by cutting down on commute time, and it ultimately saves the payer money. Caitlin's care team had to be creative in planning her care to mitigate the challenges of caring for a patient living in a remote geographical location with limited healthcare access. By employing the strategic use of digital technology, the team was able to collaborate to successfully plan Caitlin's care. Caitlin will benefit by being able to receive care at home from a team of professionals who are already familiar with her healthcare history. The family will also be relieved of stress and anxiety brought on by having to travel great distances to receive care. To better leverage remote interdisciplinary collaboration in future care situations utilizing remote communication, it is important to understand the dynamics of communication. According to Dewan and Shamaro Premusic 2018, the one thing that is missing from remote communication is body language. The lack of body language and visual cues can leave too much to interpretation. When communicating via email, text, conference calls, it is recommended that the message be written with the intent of making the message as clear as possible so that the receiver understands the message. It is recommended that the use of shorthand or acronyms be avoided unless they are team created for consensus. The use of video conferencing such as Skype is recommended whenever possible. The cornerstone of successful planning and implementation of Caitlin's plan of care was the use of digital technology. The American Hospital Association fact sheet was the most useful and relevant source of evidence because it emphasizes the benefits of digital technology in increasing access to health care. It also provided information such as statistical data on the use of digital technology by hospitals across the U.S. In conclusion, the employment of the Johns Hopkins evidence-based practice model was instrumental in planning, researching, and implementing an evidence-based plan of care for Caitlin. By researching and using digital technology to collaborate remotely, the team was able to provide care that otherwise would not have been possible. Evidence-based practice ensures the patient is receiving the best care based on the most current research.